There is a major healthcare problem in Cameroon, and the Minister of Health and the Parliament need to step in to make this situation less troubling and to resolve this issue. You see, the number one priority of every government is to protect lives and property. That is why if a car hits someone along the way and the person dies, that driver is sued. It is the state of Cameroon against that driver because the state has the right to protect its citizens. But does it end only when it concerns armed conflict? What of hospitals? A young girl died in Yaoundé yesterday, 26th of May 2026, in Corbison. This young girl was heavily pregnant and she was writing a baccalaureate. According to sources, that she had a malice while writing the baccalaureate, and she was immediately rushed to a health district in Corbison. They asked for 8,000 francs deposit, that is $4. That is approximately $16. 8,000 francs deposit before they could attend to her. They said she had only 2,000 francs on her, and she pleaded. They did not, they refused, and she was heavily pregnant. She had to rush home to see how she can get 6,000 to come back to the hospital. Upon coming back to the hospital, with the money, she collapsed. The situation got worse. She collapsed and she passed out, and minutes later, she was pronounced dead. You see, it is very sad when you hear this kind of a story because of 8,000. A hospital that has the right to protect lives, that took an oath to protect lives, they cannot take care of someone, admit the person, while pending delivery of money, while pending more calls to be made. Have we gone this inhumane? Have we gotten out of conscience that we will allow our fellow compatriots to die because they don't have money for healthcare system? How did we get here? I said it the other day. A comedian, Pa Bamenda, and Mr. Polycarp had an accident. They were rushed to Moyuka, and one of them, their situation was worse. Mr. Polycarp's situation was worse. He was sent to Boya Regional Hospital, the district hospital in Boya. Once he arrived Boya, they did not, according to sources, they did not attend to him properly until he had made an initial deposit. He was feeling pain in a government hospital as we were told, allegedly. They did not make payment. They could not attend to him until payment, deposit was put before they started attending to him. The government has a right to protect lives and property. And I'm saying this because I believe that the Minister of Health, Dr. Malauda Malachi, is not aware. I want to believe he's not aware about how Cameroonians are allowed to die in hospitals, state hospitals, because they don't have the necessary fundings to procure treatment or be diagnosed, or for doctors in state hospitals to look after them. All state hospitals in Cameroon are funded by taxpayers' money. All. Now I want to ask the question, where do the money that the doctors receive for treatment in state hospital go to? The consultation, the screening, all the money, where does it go to? Because the doctors and the nurses are under state payment of salary. All the doctors registered are under state payment of salary. Where are all the money in our regional hospitals going to? Because it is very sad. These hospitals are being funded by taxpayers' money with the objective that they will provide healthcare to Cameroonians at an affordable cost. In any normal circumstance, it should have been even free, subsidized to a certain level. People come to hospitals, they have to wait. If they don't have money, they have to wait. If they don't have money, they'll go back home before they are treated in government hospitals. They say, how did we get here? And that's why the Minister of Health need to look into this situation and go to all the respective government hospitals. Government hospitals need audit. Where all the money is going to? Because the state still fund them. The state doesn't rely on the money they generate for treatment. The state still fund them. They have a regular funding from the state. Or somebody else should come and tell us how these hospitals are run. If they cannot take care of ordinary citizens, then we should not have a government hospital. All the hospitals should be privatized. So that we should know that, okay, it's a third-party service we have to pay for. Do you know what it means? Do you know how many Cameroonians are dying on a regular basis? You have an accident, you go to the hospital, you cannot be taken care of in a government hospital because you have not done an initial deposit. Whereas the state has the state objective is to protect lives and property. Our government hospitals, where are all the money that they get from consultation, delivery, medication? Where do this money go to? Are they deposited in state treasury? Are they being deposited in state treasury? Do they actually generate money for their salary to be paid? Because their salary is paid because a mommy in a corner went and sold cocoyam and a tax deduction from that cocoyam. Their salary is paid because those of us who are paying taxes because their salary is paid, need to be paid. The hospitals need to be run. The hospital need to run in cost. And so if a citizen comes to a government hospital in a kind of compromising situation, they will ask you to make an initial deposit. If you don't make an initial deposit, that citizen will not be treated. And the state has a right to protect lives and property. So protection of lives and property ends only at the level of the military. It's only the military that has a right to protect lives and property. What of the doctors? If the government hospitals cannot take care of its citizens, then they should privatize it so that the state should stop investing in it. And that money the state is investing in it, the state should use and do something else. Because we cannot be sick. We rush to government hospital, knowing that these are the world-trained hospital where you have the best of service, where you have treatment at the lower cost based on the level in which you can afford. Then at the end of the day, you cannot afford for this treatment because you don't have money and you are allowed to die. Then privatize it. Then we should better know that, okay, it's a privatized hospital. Then we go and we know that if we don't have money, it is our problem. Mr. Minister, a lot is happening in your sector. A lot. You are doing enough, a lot. Yes, because last time I saw you, you did some visit in some hospitals, which is laudable. But a lot needs to be done. Cameroonians cannot afford for their treatment in government hospitals. Some government hospitals are more expensive than private hospitals. Screening, scanning, MRI scanning is more expensive. How much do Cameroonians earn? What is the living standard of a Cameroonian? Healthcare is the most expensive thing in Cameroon. The military are there to protect lives and properties. But the state, the healthcare also is part of lives and properties. Imagine if that girl was their family member, refused medical treatment because she did not have 8,000. 8,000. That lady died because of 8,000. And this is not the first. It's a series of, we have had these issues on recurring. We have had this issue reoccurring. Sometimes when we talk about protection of lives and property, people look at the military. The military is there for the frontier. Our hospitals are there. What are they doing?